Hi everybody, my name is Chris. I'm one of the co-founders of LabFront. It's an awesome honor to be here to showcase some of the stuff that we've been working on with other communities that are working on this challenge of solving the problems in science. My original talk title was more focused on the technical aspect, but I feel like we might get a little bit more value out of a bigger picture discussion, so I made some updates. So very quickly, I want to start with a quick show of hands. How many people have lost a loved one to, a close loved one to illness, disease, or mental health? I feel like that applies to a lot of us, and also, we know that pain. And what if I told you that, the science behind that, to understand it, the science that could potentially lead to treatments, or the science that could potentially lead to cures, were being proposed and ideas were being proposed, but everything was getting blocked by the system in place, and kind of everyone here in DSI would kind of understand that is the issue. But for me, that was kind of the thing that I found and that drove me and realized that this is something that really needs to be solved, and it's something that I kind of grew up with. So my dad's a researcher. I was part of a research project when I was 6 years old in a wearables research. I spent a bunch of time at Beth Israel in Longwood, nearby, really close by here, as a research student. And so bouncing around different labs at Harvard Medical School, basically different colleagues of my parents, I was able to see a lot of really cool things. But also at the same time, I saw that, especially because we focused on a lot of multidisciplinary work. My dad happens to be a physicist in the medical school, so it comes from a different approach. And we saw that this novelty and multidisciplinary aspect was actually getting not only underappreciated, but also was much more difficult to get funding. There was a statistic based off of a Swiss journal that saw that it was 31% harder to do a proposal if the proposal seemed like it was slightly out of the box. So there's a penalty here. And even though that these things are actually really important, they weren't understood at the time when they're being proposed. And I'll give an example, something that when we were developing and using them for the first time, I'm sure a lot of people in the audience now know of heart rate variability. But about 20 some years ago, we were talking about, there's a lot of breakthroughs that could be happening using this technique. But most of it was really not understood at the time, and now we can see actually it's a core part of a lot of fitness routines and performance improvement, and there's a lot more of that science that's been developed. So let's take a look at the limitations from on the research side. We mentioned limited funding and high costs. Well, potentially most of these projects run into the issue of getting kind of screened out, and I know that problem in centralized funding. A lot of people here I'm sure everyone here already knows that issue, and have proposed many solutions around it. So on our side, we realized that there's a lot of talk about the funding process, and I agree it's an extremely important thing to solve. But if we could look at the other side of the puzzle, the other piece, it's the probative cost of conducting research. So even if we did solve the funding problem, if we don't solve the cost issue, we'll still run into a very similar issue. Well, your money will run out, and you can still limited. So quickly, a little bit about why is research so expensive. And again, I'm focusing on health-related research. I mentioned human subject research, so this will be probably very different from the last speaker's work in space exploration. But basically, due to largely outdated processes, outdated tools, expensive medical devices, and a technical barrier. There's just a lot of inefficiencies within the current system, and that makes even entry-level simple research projects really, really expensive. And entry-level research projects being really expensive is a huge bottleneck for anyone that's applying for their first grant, because essentially if you need a grant and you can't really prove they've already done something, you end up on that vicious cycle where you can never get funding, and that ends up causing a lot of people to actually switch careers or move. Or for example, I ran into multiple doctors that are interested in being physician scientists, but just focused on the physician aspect of it because it was just so hard to get the funding they needed to run the projects. So this will be the only time I'll talk a little bit about my company side, but basically, so we focused on creating a solution to streamline health sciences for human subject research, using stuff like wearable devices that could be used consumer grade. We partnered with the Garmin, for example, to access their raw data so that we could replicate medical level sensors from a device that only costs $100. Usually they cost thousands of dollars for a medical device equivalent. Open up remote data collection and then automated analytics. Basically, all those things combined help us bring down the cost of a research project by a factor of 10. So what does 10xing a study actually look like? So in a real use case, we had a volunteer firefighter study. It was looking at 24 volunteer firefighters and looking at how, based off their schedules and their sleep schedules, how ready were they for duty, because they would wake up at, they'd be called awake at random hours, and what kind of schedule might be working to optimize that. This project was originally budgeted, it's going to cost around $50,000, but the researcher themselves did not have that budget. They worked with us, and we were able to bring that cost down to around $5,000. So for a full research project with the publication and under $5,000 in extra cost, not considering the time cost, obviously, for the research themselves, but that is really like an exponential difference in terms of the pricing, and also makes a small change in the alteration of how you look at what is possible or where you should seek funding from. Because if you need to seek 100K or 150K in funding, you have to go to the NIH, or there's very few other places that give out that amount in that frequency. But if you're looking at a $5,000 or $10,000 chance, that completely changes. That could be something that the university itself might have a pilot funding for. So this is all stage one of our kind of master plan. I mentioned before a little bit about the experience. Myself, when I grew up, when I was in third grade, my grandfather passed away from lung cancer, and it's something that, it was the first real loss that I went through as a child, and obviously it made a big difference. And growing up in an Asian family, there's this very strong, I would say, sense of responsibility to take care and figure things out as the firstborn male in the next generation. And I remember thinking about how this thing that was just this in general, and death in general, and the science behind it, looking into lung cancer and realizing that it's one of the least funded cancers because it's considered something that's, a lot of people that have it are just due to smoking, and it's something that's like, it's their own choice kind of thing. So that limits the funding. Regardless of that, that was the first time I kind of saw the difference that perceptions would have on terms of funding, but also play through to health and outcomes. So our plan was to start with the research side. That was our background, and start by solving what was going on in research. Solving is obviously not solving everything, but addressing some of the problems. But then to apply those findings into healthcare itself, or actual health management, healthcare. So, and over the last 12 months, I've been starting to, we've been working on the product, we released it, doing all those things, and then finally having time to actually go out and seek feedback and work with different communities. And I was fortunate enough to met a bunch of people in the DSci community and that were already working on these problems. So today I wanted to give a little bit of a high-level overview of what we're working on now as a way to kind of open the conversation and say, like, is this the right direction? Do we think this is necessary? And I've already had a couple of these conversations with a couple of people here already, and so that's really what it is. It's not we're not pushing like this is the solution, but more this is a discussion. This is what we have so far. So the three-step plan in ours, after learning about some of the, I would say both the capabilities, but also some of the the technical capabilities, but also the ideologies behind Web3. I think there's a lot of opportunity to use it to solve many of the problems within research where already from what I'm seeing right now. But the first stage is where we're at right now, which is we need to even bring them to Web 2, because a lot of researchers that we're working with, a lot of this work that they have is still not digitized. If it's the data might be digitized, the processes might not be. So there's a lot of things within that itself that is just massively inefficient. And again, I think everyone here knows that there's a lot of issues in this process. But after that, the aim of that to get a 10x reduction, and a 10x reduction, to the cost will be significant. But the second part, which is kind of actually alluding to the last speaker mentioned, is that a huge problem is just the lack of reusability of data collected, especially human subject data. And if there is some kind of marketplace or sharing mechanism, that could easily 10x again. And then once you have those things, you have a 100x difference in cost. Now all of a sudden, a lot of different funding mechanisms can work, because you don't necessarily need to be funding a $100,000 project. If a $2,000 to $5,000 can fund multiple projects, that would be useful for everyone in the system. So a little bit deeper dive into stage 2. So stage 1 is where we are right now, which is building traction among researchers. Stage 2 is where a lot of opportunity lies, which is the majority of data that is collected for human subject research is not reused, even within the lab. So we have labs that collect the data and they put it into some kind of thumb drive or some kind of hard drive somewhere, and then they forget about it, and it ends up never getting used. I've seen this happen in multiple labs. It doesn't really matter how reputable the lab is. The systems are they're just not built to kind of facilitate this data usage. So first thing, making data reusable. But the second part of it is that reusing data has a big issue, has a big risk involved, which is due to basically sharing data to third parties, and then basically losing control of your own data. But with some of the newer, or I guess they're not new, but some of the proposals for multi-party computation or fully homomorphic encryption, there is now and improving processing speeds and computes to make it reasonable. There are now methods that we can use to actually share data without exposing data, and that really means that we can kind of build privacy and security into the mechanism, and potentially even use some Web3, like smart contract or something that can dictate the way that the data is actually being utilized and require permission giving at all stages. But let's take a more practical example. What does that actually look like? So, before we mentioned the firefighter study. So that data was collected from volunteer firefighter participants, and that project basically used just LabFront to collect the data, analyze it, all that stuff. Now, assuming the project is over now, in this new world, instead of that project data being just dead and lying there, there is a possibility for it to be reused and for multiple purposes. So each participant, it starts with this kind of connects to decentralized identifiers or centralized identifiers. I guess it doesn't really matter right now. But for the sake of some kind of way to identify the originators of data and create an ownership around that. And once they have their own data, then they can do with it what they want. And so potentially listing their data to be licensed to other research and other projects. You've already collected it, it's just sitting there, why don't you put it to use? So potentially you could see a situation where the data itself generated by myself as a user can be handled through a data coalition that lets me specify what kind of projects I want it to use for, when should I comp the projects to make it free, if there's some things I believe in, I want to support, and how aggressive should they be about licensing out the data, how much privacy am I willing to give up, because at some point sometimes you still need to give up some privacy for a research project. And all that could be handled through data coalitions. And so when a researcher is starting a new project, let's say there's a new project around assessing which people would be good volunteer firefighters, just to kind of measure based on, maybe there's cognitive measurement or just like their habits and fitness, which people would be the ones that would serve well in this position. Instead of completely restarting and capturing that data again from zero, they would just put a request for data and specify the context and how they want to use it. And then they would interface directly with data coalitions to be able to kind of gather that relevant information and pay for it out of a fraction of the original cost that it would have taken to actually generate the data in the first place. And if more data is needed, which is very possible, it would be very easy to put out a request as well to say there's incremental payment for participants that complete this so that they can finish off the data set. In that case, maybe you add a questionnaire or you add something else. You're basically just adding an incremental amount. So each time you're adding to the database, but you're actually not collecting everything from scratch. So self-explanatory why that would be save money. This also solves the participant incentivization model as well, that on top of you're not just getting paid for this project. The potential is when you get paid for this project now, you could be getting paid for this project in the future. Kind of like, you're an artist on Spotify or an influencer on YouTube. It depends on the views. So if you start to kind of accumulate a lot of projects, especially different types of projects, you might be able to, make a lot more or utilize that data in a way that you can make more money off of it. That's the same one. So this could be all what the future of research entails. And if we kind of remove the major barriers in terms of data capture and data analysis, which is the majority of the costs that are not the costs that cover the researchers themselves, that reduces so many hurdles. And I think what I'm most excited about is more community-driven and funded research projects. So imagine a situation where you have there's a disease community, obscure rare disease community that has around 10,000 people in the entire United States that have this disease. This is something that statistically would not be relevant to NIH, even though obviously it affects a lot of people, but that's too small for them to throw significant budgets at, and also to focus and know how to handle it. But 10,000 people is 20,000 parents, on average 10,000 siblings, 20 to 50,000 friends, close friends that would be willing to support. So within that community, it'd be pretty easy to imagine a cost-effective way to sponsor researchers if essentially they could, they basically didn't have to capture data for free. They could capture data for free and analyze it for free. And that would kind of let us start addressing all the other problems, such as funding mechanisms, information distribution, replication, and more. The reason I'm bringing this up and we've been thinking about this is because we have created although this is all hypothetical, we've been testing out different elements of this within LabFront platform itself. Again, we focused on getting traditional researchers on the platform because we need to conquer Web 2 before we can bring them to Web 3. But there's to do this, we need that kind of like that network effect, and we need both the buyers and the sellers, and that's a hard thing to seed, especially in this system, in this field. So I think where LabFront might come in is, we launched in 2021 as a product for health researchers. Since then, we have nearly 800 research customers, over 100 universities, including here at BU, and a bunch of universities nearby. And tens of thousands, approaching hundreds of thousands of research participants. And so I imagine potentially if our growth continues, there could be a potential for us to bootstrap off of the existing data user base and allowing so we can immediately see what the hardest part, which is like starting a marketplace, is to have actual both sides of the system. But to do this, we need also to kind of seamlessly transition ourselves into Web3, and also really, I think what's really important is to be focusing more on the principles rather than always focusing on the technology. I think a lot of times, and I suffer from this as well as someone that is, a technical person. Sometimes we do fall in love with the code or a solution, but we don't actually take into account the human component. And so in this part, I consider this transition really important to be able to figure out how do we actually onboard people into this experience, because essentially my idea is that the majority of the researchers that we work with are 60 plus years old. We're not going to teach them how to handle their keys and wallets and stuff like that just to be able to do the work that they already want to do. But essentially, if we can handle that and abstract that layer, then there's a lot of stuff that we can do. And so this is a thing I would love to discuss further. If people are interested in, just come up to me and find me. But yeah, this is still a process that we're in the process of thinking about and figuring out. At the end of the day, let's not get ahead of ourselves. We're still in stage 1. I mean, we've been doing this for about 3 years in this product itself, but before the product, we spent 2 years building it, and in the space entirely thinking about it, almost a decade in the space. And I feel like we are finally in a point where we're starting making some traction, but we're still super early. As much as I like to think about the future using the possibilities of decentralization and Web3 and democratization, it's still something that's very, a little bit far away. I think we still need to focus. This is kind of where So basically, that's where we are today. We're really interested in pursuing this direction. And we see lots of possibilities to kind of build upon this, to allow other funding mechanisms, other ways of replication that make it easier, because for essentially all the data is stored encrypted in one way that makes it easier to handle. But right now, again, it's just it's an idea and a thought, and we're open to collaboration. And specifically, if you do have researchers, we're in the stage where we're trying to get more researchers to be able to save time and money, because honestly, there have been very few new products to hit research, and they're not even used to going and looking for those products. So that's kind of the biggest issue. And we need to get to Web 2 before we can get to Web 3. So that's my talk. Thank you. All right. Question, Josh.
Really great to see an existing business coming into Web3 and looking to utilize some of the tools. You mentioned a data coalition. How are you thinking about a data coalition?
That's a great question. There's a lot of things to think about data coalitions in terms of how it would work. I feel like this is one of the things I would love to workshop as well, because I feel like we did a pilot where we basically acted as a data coalition to kind of walk through the steps and figure out what it would take to actually get people, people are licensing the data, we have to communicate and automate that entire process. I think it would work around is essentially setting high-level rules around what you would do with it, how aggressive you would be about your strategy of licensing data, and what kind of projects you would support and different things like that, and then the aggregation, and then helping to do the matching. But that's one of the things that we're still thinking about.
Are you thinking about it in a proprietary system, or a system across, for example, EVM in general?
Yeah, not proprietary. Yeah, we think, but. Practically for us, we're doing a lot of stuff internally, and basically faking the experience in a way so that we can test out if it actually works before we invest the resources to fully move things blockchain or build it out.
Hi, Chris.
Hey.
So from a Web 2 standpoint, platform makes sense. From a Web 3 standpoint, there are a few entities that are doing something similar. But the one key point that always stands out is, for example, in the case of leveraging wearables, that data first goes to a centralized entity, which are already leveraging and selling it or licensing it out to third parties. And then the narrative is, well, you as an individual can leverage your wearables to then decide. But there's that intermediary piece that is kind of shooting that in the foot. How do you envision that the necessary changes that need to happen there to bring this into an actual Web3 truly patient-centric space?
Yeah, definitely. That's a great point. So the couple ways around that, and it does need industry support as well. But what we've done with Garmin as one of our major partners is there's two ways to utilize it. You can go through their app, their cloud services system, which goes to the centralized entity. They do what they do. They say they don't sell data, like whatever. We can't really, whatever. We take it at, with a grain of salt. But we do have, through our partnership, SDK access, so we can directly interact with the devices themselves. And so we've seen a couple manufacturers willing to do it. Apple will probably never let you do that, so it's not going to work there. But I have seen more and more support gaining for this, like essentially you're using just as a device. And it doesn't come with any of their software built in. So essentially, you connect to the firmware is directly, and then you can start replicating. So I think it is coming, but is it immediate? No, we're still very early in this. Thank you for the question. Any other questions? Yes.
How do you see expanding IoT devices, and how much of data do you envision yourself like actually putting on the blockchain? Because there's data limits and whatnot.
Yeah. Right now, I don't see a way to put the data on the blockchain in a way that I think is would be very effective, unless we can, because we're collecting a lot of data. And so, for example, when we turn on the sensors on this device, I can get like raw PPG or accelerometer, 100 hertz, and maybe collect that for 12 months for a project. There's no reason to even put that data up there, right? So I think it's going to be a mix between references to the data and so it's the same kind of thing. I don't think it's I'm not like we have to put everything there because that's the only way to do it. But I would say the ownership aspect of it handled there it makes the most sense.
Yeah, if I could ask about privacy, because that's the biggest thing with any IoT devices.
So this is something that we worked on before, but then we decided to use third-party, like other manufacturers' devices already. But we did start developing our own devices before. This is 2.5 years ago, and that would just kind of an option that you don't have to go through other parties, and it'd be priced competitively. But again, will that catch on to mainstream? You're still competing against most IoT houses. They're going to be using Nest or Ecobee or whatever. And we're not, even if we make our own, it's not like adoption's not going to be that high. So we do see it from a pure research standpoint. We can replicate some things, but we'll still have to work within the parameters of our current capital system. Yeah, James.
So I really think that this is important for researchers. I was big into the quantified self field personally to analyze my own body, especially with regards to sleep. So I tried Oura Ring, massive put on bed, the whole 9 yards. Despite my excitement about that, I found myself turning as a user from using these things. I was hoping you could speak to the human aspect of contributing your data to research and how you think you can keep people incentivized or continue to care on sort of long term as our lives continue to bring us more things that perhaps are more important to us than contributing to research.
That's an awesome question. I would say all applications, I feel like for most of the things that we have for wearables right now are really more nice to have in a sense. There's definitely value to them, but to me, when I see it, it's this is a very new and not very mature industry yet in terms of what we can even do. And one of those limitations is actually just the lack of research in the spaces. It was hard to collect that data. Oura Ring makes it super easy, right? But 5 years ago, before Oura Ring, it was very difficult to collect this data. So we're going from clinical setting to this entire world where maybe we can do remote data capture and completely open up the data, the floodgates. So I feel on one side, the first part of your statement, not question, is just that I think there's a lot more things coming, and that's actually why we positioned, because we were actually doing application before, but we realized that most of the applications we could build are pretty primitive, and it requires better data and better research and better algorithms to kind of create the real, I think, the experience you want, which is that like sticky experience that really helps your sleep, like it optimizes your performance. You do it, you don't have to think about it, like that kind of like coaching / whatever, health and management, whatever, is a thing I think we're more and more seeing that is going to be possible, but it's just really early. Sorry, what was this actual question?
Long-term incentives to keep people
Yeah.
like wanting to I've gotten to the point where I just stopped turning my Oura ring because
Yeah.
I know what to do with my sleep. I've understood it, so I
Yeah.
just basically got rid of it.
Yeah. So I think right now research, there's a big gap between the actual people that are conducting the research projects and the people that are giving their data for this research, right? And there's and for a lot of different reasons, but there's not that much transparency. Sometimes they're keeping it from publication and other things like that they need to protect their intellectual property or whatever. But at the end of the day, it's the same thing, which is users aren't really engaged with what they're actually doing and the value that their data could provide and learn from. And so I feel on this side, it's more, there's going to be more and more things that we can provide that are insights to the users, because essentially we would be spanning, like I'm playing this out, we'd be spanning like a lot more types of research. It's not just things to do with Oura, but we bring in the metabolic health and the other thing, sleep studies, but also just other types of nutrition, whatever. So I feel it's a real problem, but I think you potentially could solve it with a better interaction between more participation, in the sense that you can do more stuff. Like right now you're stuck because you've already optimized as much as you want to and can. But maybe there's another level of your performance that's not sleep, that sleep affects, but there's other things that could be measured and could be, could be like offered to you. I'm like, oh, maybe I'll try this out. So I think there's a novelty thing, but again, this is a hard, difficult problem. Yeah, thanks. But, yeah.
Last question?
Yeah. It seems like your value prop is, if I understand correctly, data from wearables that's collected during studies or clinical studies. Aren't like studies conducted with particular hypotheses in place, and so you collect specific types of data with maybe people under particular drugs and things like that? What customers are interested in that data collected under very specific conditions?
Yeah, so basically you can imagine, so one study that was collecting just a bunch of people that were looking at, let's say like COVID vaccine efficacy, right, for this one vaccine. Through that process, potentially they collect some heart rate data, some temperature data, some other things. Let's say there's another study that's an epidemiology study that's just interested in what happens when people that are not, like, they're staying at home, confined at home, which happens to overlap with that COVID study as well. So what we're saying is that there's so much data that's being captured. Right now, none of it is being reused at all. Now, imagine if 75 or 80% of that data can be used for this epidemiology study, but then you still need something else. It'd be a lot easier just to get that supplement rather than do the entire study again. So that's kind of how I think.
Yeah, I guess my question is, do people want to reuse that data?
There's a platform called PhysioNet, which just, if anyone's familiar with it, they have a large open source database. It was like initiated in the early 2000s, and NIH funded it. And originally they were like, oh, no one's going to use this data. And then it became the most important data resource because a lot of researchers still want to look at retrospective or just like follow along. So we've seen that data can definitely be used, but the difficulty is the format and how easy it is to access it. Because if you have to code it yourself and do a bunch of different things to get it to a point where it can be used, then it's almost not worth it. That's the issue that we run into. The data itself can be very useful, but there's a lot of other things that they need to do to clean it to get to a point where they can use it. I'm hoping that we can, if we create a standard for that, we can optimize that away. All right.
Just have that.
Last one. Yeah.
Quick follow-up. Can you expand on your thought process on creating a standard as compared to creating common formats as mechanisms to support the adoption, common formats and common standards, obviously, there's a lot of standardization work going on, none of it's really getting any traction.
Yeah. So I think I think that's my approach for all of it. It's you create this, like, the standards that matters, the standard people use, right? And nothing else really matters. And there's plenty of standards that we can decide to use, but the one that actually being used is what matters. So we're doing it in the same process where we're adopting it, and then it's automatically rolled out to all our customers. They're utilizing it, and that becomes a standard itself. And so to do this, we have to also understand that there's not very few people actually working in the research market to try to solve problems and like create companies that have solutions for this. It's actually pretty untapped from that perspective, and it's relatively more straightforward to kind of dominate that market so that you would have a standard. Like if we look at like healthcare systems or like EMR, electronic medical records, like Epic has massive majority control. I think it's like 80%. And so we could see potentially in this kind of market, if we provide the right values, that whatever standard that we could use because it's useful becomes a standard. And that's how I approach it, rather than like optimizing on a new standard. Yeah. All right, I think that's it. All right, thank you everybody.